Liberia was the third country to be hit by the 2014-2015 Ebola outbreak. It had the most reported deaths at more than 4,800. Health workers in particular were severely affected. This was attributed to a fragile health system as well as lack of awareness. 5 years on, authorities say the health systems are much stronger. CGTN Susan Mwongeli reports.
CH Renee Hospital is the largest public hospital in Monserrado in Liberia. The hospital was hardest hit by the Ebola outbreak. Like most hospitals, it was temporarily shut down after several of its prominent health workers died. CH Renee lost over 40 health workers, with 100 plus others infected. Orator was working at the hospital at the time.
We didn't even have GYN gloves. We were just using examination gloves. And our friends kept telling us, look, Ebola is real. Ebola is real. You people have to take time. But then you come to work and pregnant women come, what will you do? You will not send them back. You have to attend to them.
During the height of the outbreak, she attended to a 16-year-old girl that was 28 weeks pregnant. The girl came in bleeding heavily, prompting an emergency delivery. After an unsuccessful attempt to deliver the baby, both mother and child succumbed.
So after I have been 9 days before my son called me to tell me, say, oh, the patient you attended to, they said the patient is positive. In fact, the viral load is high. So I broke down. I feared they were not fair to me because I was giving care. I think it was just simple to tell me, say, look, the patient was positive. I think you need to isolate yourself from your family because we all know what Ebola did at that time. But they left me undone and nobody told me. So I felt bad, I felt terrible.
A World Health Organization report at the time showed that health workers were between 21 and 32 times more likely to be infected with Ebola than people in the general population. Part of the reason was poor training, too few staff members, and shortage or improper use of protective equipment. Fast forward, and there have been some changes. The hospital has expanded to include more bed capacity. But some of the same issues still persist.
The patients come to the hospital without anything. We all know the present situation in our country. There is nothing absolutely in the country. Can you imagine we can even buy, like last day we're buying sheets to do patient, to take down patient report or history. Yes, that's how bad it is.
Other challenges include frequent power outages. Emergency services are lacking. Only months ago, in September, health workers took to the streets protesting low wages and poor working conditions. Government says it has no money.
Last year, our total budget to the health system was $77 million. Now, out of the $77 million, almost $45 million went towards salary payment for healthcare workers. And the balance go towards supplies, medications, and you name it, drugs and so forth. If you look at our essential drugs, in order to meet the demand, we need about $22 million a year to meet that demand. And from the balance that is left over, it just cannot. So we depend on donors, we depend on partners. But the partners themselves, as the country improves, their support drops.
But despite the challenges on the curative side of the health system, Liberia has taken steps forward with regard to surveillance and early detection.
And so we understand the gravity of what Ebola is or any infectious disease. As we speak now, we are personally dealing with 3 Lassa outbreaks in the country, and the country is quiet. And until I say to you, you will know. And this is the kind of system we have, because one of the key things about dealing with outbreaks is that if you have the diagnostic capacity, and this is what we didn't have that led to some of the issues. Now we have the capability in country where it doesn't matter what it is, within 12 to 48 to 24 hours, we can tell you which of the disease we are dealing with, and by then our contact tracers, based on the strong surveillance system that we have, we can make sure that we continue.
No doubt a major development, but for a country whose health sector is almost non-existent, early detection is just but a drop in a deep ocean. A lack of basic essential services like ambulances, proper equipment, medicine, and a demotivated workforce only means more lives could be lost. Susan Mwongeli, CGTN, in Monrovia, Liberia.